Hello all, myself Helena Joy, lecturer from SNS College of Allied Health Science in the Department of Radiography and Imaging Technology. I am going to discuss a topic about intravenous urogram. Intravenous urogram, it is the radiographic examination of urinary tract including renal parenchyma, calyx and pelvis after intravenous injection of contrast media. What are the anatomies included? Kidneys, a pair of bean-shaped organs approximately 12 cm long, then extended from the vertebral level T12 to L3 when the body is in the erect position. The right kidney is positioned slightly lower than the left because of the mass of the liver. Internal structure of the kidney. Within the dense connective tissue of the renal capsule, the kidney substance is divided into an outer cortex and an inner medulla. This is the shape of the kidney. Indications in adults: screening of entire urinary tract, especially in cases of hematuria or pyuria, differentiation of function of both kidneys, abnormalities of ureter, obstructive uropathy, TB of the urinary tract, calculus disease, renal colic or flank pain. In children, water anomalies, malformation, neurological disorders affecting urinary tract, recurrent urinary tract infection, anorectal anomalies. What are the contraindications? The contraindications are iodine sensitivity, pregnancy, severe history of anaphylaxis previously carries a 30% risk of similar reaction on a subsequent occasion. This risk is lower with low osmolar contrast media. Contrast media, the doses, non-ionic contrast media, mostly Ioxol Omnipac is used. If it is 300 mg, 40 to 80 ml is used. It is 350 mg, 40 to 80 ml is used. Mode of injection. Contrast media is usually given as IV bolus injection within 30 to 60 seconds. The density of the nephrogram is directly proportional to the plasma concentration of contrast media. More iodine increases the density of the nephrogram. Large dose of contrast media increase diuresis, which distance the collecting system, thus increasing the diagnostic information from the urogram. Patient preparation. For adults, ask for any history of diabetic mellitus, phoeocreatoma, renal disease or allergic to drugs and any specific foods. Fasting for 4 hours is compulsory. Do not dehydrate the patient. For children, no pediatric patient should ever be purposely dehydrated as it is hazardous to do so. Colon should be empty for IVU. The child posted for urography must not have a full stomach to avoid vomiting, so the child should not be given anything by mouth for 3 to 6 hours priorly to the procedure. Procedure in adults. Patient is placed in supine position with pelvis at the cathode side of the tube. A support is placed under the patient knees to reduce lordotic curvature of lumbosacral spine and provide comfort. A scout film is taken including the kidneys, ureter, bladder and urethral regions on a large size film. Contrast media is injected intravenously into a prominent vein in the arm. The contrast is rapidly injected within 30 to 60 seconds. In children, equipment should be capable of short exposure to avoid motion blurring. Moving grid is used. Source to image distance should be 40 inches or 1 meter. Contrast non-ionic contrast media. Doses 1 to 2 ml per kg. Filming. First film is taken 15 minutes after injection of contrast media. What are the filming techniques? It should be used with low kV. kV should be within 65 to 75 and high MAS. MAS should be within 600 to 1000 MAS. How many films are taken? The standard films are taken in different views in different minutes. What are the standard films? We'll see in the following. Plain X-ray KUB 14 into 17 inch film. Plain X-ray should be in 14 into 17 inches film. 1 minute film should be in 10 into 12 inch film. 5 minute film should be in 10 into 12 inch film. 10 minute film should be in 15 to 12 inch film. 15 minutes film should be in 15 to 12 inch film. 35 minutes film should be in 14 to 17 inch film. Post void film should be in 10 to 8 film. So totally 7 films are taken. First film should be a plain X-ray and the next should be in 1 minute. Next, after that, after 1 minute, 5 minutes film should be taken. After 5 minutes, 10 minutes film should be taken. After 10 minutes, 15 minutes film should be taken. Then 35 minutes and the post void. After post void, the patient can leave the X-ray hall if there is no complications. The complications will be cardiac failure, dehydration, diabetes, previous allergic reaction. Aftercare. Observation for 6 hours, prevention of dehydration, watch for late contrast reaction. In high risk patient, a renal function test should be done to watch for deterioration. Thank you.